Do you leak urine when you cough or sneeze or laugh? Have you been avoiding certain exercises that you normally love because you're afraid you're going to leak? Do you avoid playing with your kids or jumping on the trampoline at birthday parties because you have a fear of embarrassment if you wet your pants? If you answered yes to any of those questions, you have stress urinary incontinence. If you want to learn about how to manage stress incontinence, improve your symptoms and your quality of life, keep listening to hear some tips. Tip number 1, Kegel exercises. If you can do your Kegel exercises to help to strengthen your pelvic floor, you're going to notice a reduction in stress urinary incontinence. This is because the accessory muscles in our pelvic floor can allow us to contract and give more support to the urethra. The loss of support to the urethra after aging, childbirth, menopause, it's what's leading to the stress incontinence. Tip number 2, weight loss. Being overweight or obese is a risk factor for stress urinary incontinence, especially women who carry a lot of weight in their midsection, because that weight puts a lot of extra pressure on the pelvic floor. Women who can even lose just 10% of their body weight are going to notice an improvement in their stress urinary incontinence. Tip number 3, quit smoking. Smoking is associated with a decrease in the quality of our connective tissue, which affects our support of the urethra. It's also associated with something called intrinsic sphincter deficiency, which means the sphincter that goes between your bladder and your urethra, which is kind of like a stop valve to stay closed to keep you watertight until you're in a socially appropriate position to lose urine, becomes weak. And so when you do simple things like cough, sneeze, laugh, or even just standing up out of a chair, that sphincter is no longer strong enough to hold the urine back, and you're going to have more accidents. So there's 3 simple things that you can do to decrease your risk of having stress urinary incontinence and to improve your symptoms if you're already suffering from incontinence. I hope you learned something that's going to help improve your quality of life. And if you like those tips, make sure you like, follow, and share.